Medical laboratories are essential to healthcare. They provide vital information for diagnosis, treatment, and disease prevention. These labs handle potentially hazardous materials. Therefore, safety is paramount. ISO 15190-2020 provides a framework for managing risks and ensuring safety in these critical environments. Medical laboratories are complex environments. They involve a wide range of hazards. These hazards include biological agents, chemicals, and radioactive materials. Exposure to these hazards can cause serious health issues. These issues range from skin irritation to life-threatening diseases. ISO 15190-2020 Medical Laboratories Requirements for Safety is an international standard. It outlines specific safety requirements for medical laboratories. Adhering to this standard is crucial. It protects laboratory personnel, patients, and the environment. By implementing the guidelines outlined in ISO 15190-2020, laboratories demonstrate a commitment to safety. This commitment fosters a culture of responsibility. It ensures that laboratory work is carried out in a manner that minimizes risks. Ultimately, it safeguards the well-being of everyone involved. ISO 15190-2020 is a crucial tool for medical laboratories worldwide. It provides a comprehensive framework for establishing and maintaining a safe working environment. The standard emphasizes a proactive approach to safety, focusing on risk assessment and the implementation of effective control measures. This standard outlines specific requirements for managing various hazards. These include biological, chemical, and radiological hazards. It addresses risk assessment, facility design, equipment safety, personal protective equipment, waste management, and emergency preparedness. Compliance with ISO 15190-2020 is essential for any medical laboratory. It demonstrates a commitment to providing a safe and healthy work environment for all personnel. It also ensures the accuracy and reliability of test results. By adhering to the standard's guidelines, laboratories can minimize the risk of accidents, injuries, and exposures. This not only protects laboratory personnel, but also safeguards patients and the public from potential harm. ISO 15190-2020 applies to all types of medical laboratories. This includes those in hospitals, clinics, and private practices. It covers all aspects of laboratory safety, from the design of the facility to the handling of hazardous materials. The standard is applicable to all personnel working in the laboratory environment. This includes laboratory technicians, scientists, support staff, and management. It also considers visitors and contractors who may enter the laboratory. The scope of ISO 15190-2020 extends beyond the laboratory itself. It emphasizes the importance of proper waste management to prevent environmental contamination. It also stresses the need for effective communication and coordination with other departments within a healthcare facility. By addressing the specific needs of medical laboratories, ISO 15190-2020 provides a practical framework for ensuring safety and compliance. It serves as a vital guide for laboratories striving to provide the highest quality patient care while protecting their most valuable asset, their people. Understanding the specific terminology used in ISO 15190-2020 is crucial for its effective implementation. The standard defines key terms related to laboratory safety to avoid ambiguity and ensure clarity. Risk assessment, for instance, is defined as the process of identifying hazards, analyzing their potential impact, and determining appropriate control measures. Hazard refers to anything with the potential to cause harm, such as a chemical, a piece of equipment, or a work process. Personal protective equipment, PPE, encompasses items like gloves, lab coats, safety goggles, and respirators, worn to minimize exposure to hazards. Emergency preparedness involves developing and practicing procedures for responding to various emergency situations, such as fires, chemical spills, or medical emergencies. By clearly defining these and other key terms, ISO 15190-2020 provides a common language for laboratory safety. This shared understanding is essential for effective communication, training, and the development of a robust safety culture within the laboratory setting. Section 5. Leadership in Safety. The role of management. Management plays a critical role in establishing and maintaining a culture of safety within a medical laboratory. Their commitment to safety sets the tone for the entire organization and is essential for the successful implementation of ISO 15190:2020. Management is responsible for providing the necessary resources to support safety initiatives. This includes providing appropriate training, personal protective equipment, and safe workspaces. They must also ensure that all staff members are aware of the laboratory's safety policies and procedures. Regular safety inspections, audits, and performance reviews are crucial for identifying and addressing potential hazards and areas for improvement. Management should actively encourage a culture of open communication, where staff feel comfortable reporting safety concerns without fear of reprisal. Ultimately, management's leadership in promoting a safety-conscious environment is paramount. A strong safety culture not only protects employees and patients, but also enhances the laboratory's reputation and credibility. Section 6. Risk Management. Identifying and mitigating potential hazards. Risk management is at the heart of ISO 15190:2020. The standard emphasizes a proactive approach to safety, requiring laboratories to identify potential hazards, assess the risks they pose, and implement effective control measures. The risk management process begins with hazard identification. This involves carefully examining all aspects of laboratory operations, from the handling of chemicals and biological agents to the use of equipment and the disposal of waste. Once hazards are identified, their associated risks must be assessed. Risk assessment considers the likelihood of an adverse event occurring and the potential severity of its consequences. Control measures are then implemented to eliminate or minimize risks. These measures might include engineering controls, such as fume hoods or biosafety cabinets, administrative controls like work procedures and training, or the use of personal protective equipment. Regular review and reassessment of risks are crucial, as laboratory operations and procedures may change over time. By embracing a continuous risk management approach, laboratories can proactively identify and mitigate potential hazards, creating a safer work environment for everyone. Section 7. Safety Procedures and Practices, a foundation for a secure environment. Clear and comprehensive safety procedures are fundamental to a safe laboratory environment. ISO 15190:2020 mandates the development and implementation of procedures covering all aspects of laboratory work. These procedures provide step-by-step instructions for performing tasks safely and minimizing risks. Procedures should be developed for handling hazardous chemicals, biological agents, and radioactive materials. They should cover the use of personal protective equipment, waste disposal, emergency procedures, and the use and maintenance of laboratory equipment. All procedures should be documented, readily accessible to staff, and regularly reviewed and updated to reflect current best practices. Training is essential to ensure that all laboratory personnel are familiar with and understand the importance of following established safety procedures. Regular training sessions and competency assessments reinforce safe work habits and minimize the risk of errors or accidents. By implementing and rigorously adhering to comprehensive safety procedures, laboratories can establish a culture of safety and minimize the likelihood of incidents occurring. Section 8. Facility Requirements and Equipment Safety, creating a safe workspace. The design of the laboratory facility and the safety of its equipment are critical aspects of laboratory safety, addressed in ISO 15190:2020. The standard provides guidance on facility layout, ventilation, emergency equipment, and the safe use and maintenance of laboratory equipment. Laboratory workspaces should be designed to minimize the risk of accidents and exposures. This includes ensuring adequate space for work activities, clear walkways free of obstructions, and appropriate storage for chemicals and other hazardous materials. Ventilation systems play a crucial role in removing airborne contaminants and maintaining air quality within the laboratory. Regular inspection and maintenance of laboratory equipment are essential for ensuring its safe operation. This includes calibrating equipment, checking for wear and tear, and promptly addressing any malfunctions. Emergency equipment, such as eye wash stations, safety showers, and fire extinguishers, must be readily accessible and in good working order. By adhering to the facility requirements and equipment safety guidelines outlined in ISO 15190:2020, laboratories can create a physical environment that supports safe work practices and minimizes the risk of accidents and exposures. Section 9. Personal Protective Equipment, PPE, shielding scientists from harm. Personal protective equipment, or PPE, acts as a barrier between laboratory personnel and potential hazards. ISO 15-190-2020 emphasizes the importance of selecting, using, and maintaining appropriate PPE to minimize the risk of exposure to biological agents, chemicals, and other harmful substances. The selection of PPE should be based on a thorough risk assessment of the specific hazards present in the laboratory. Common types of PPE used in medical laboratories include gloves, lab coats, safety goggles, face shields, and respirators. Proper training on the correct use, donning, and doffing of PPE is crucial to ensure its effectiveness in protecting personnel. PPE should be readily available to all laboratory staff, and its use should be mandatory when handling hazardous materials or performing procedures that generate aerosols or splashes. Regular inspection and maintenance of PPE are essential to ensure its continued effectiveness. By providing appropriate PPE and ensuring its proper use, laboratories can significantly reduce the risk of occupational exposures and protect the health and safety of their personnel. Section 10. Waste Management, handling hazardous materials responsibly. Proper waste management is critical for maintaining a safe and compliant laboratory environment. ISO 15-190-2020 outlines specific requirements for the handling, storage, and disposal of hazardous waste generated in medical laboratories. The standard emphasizes the importance of segregating waste at the point of generation, using clearly labeled containers for different waste streams. Waste containers should be compatible with the materials they contain, leak-proof, and disposed of according to local regulations. Sharp waste, such as needles and blades, require special handling and disposal procedures to prevent needle stick injuries. Chemical waste must be managed carefully to prevent spills, leaks, and incompatible mixtures that could pose significant hazards. Laboratories are responsible for developing and implementing a comprehensive waste management plan that outlines procedures for all aspects of waste handling, from generation to final disposal. Proper waste management protects laboratory personnel, the environment, and the public from potential harm. Section 11. Emergency Preparedness, planning for the unexpected. Despite best efforts to prevent them, emergencies can occur in medical laboratories. ISO 15-190-2020 stresses the importance of having a comprehensive emergency preparedness plan in place to effectively respond to and mitigate the impact of such events. The emergency plan should outline procedures for responding to various emergencies, such as fires, chemical spills, natural disasters, and medical emergencies. It should include evacuation routes, assembly points, and contact information for emergency services and key personnel. Regular drills and training exercises are essential to familiarize laboratory personnel with emergency procedures and ensure they can respond effectively in a crisis. The plan should be regularly reviewed and updated to reflect any changes in laboratory operations, personnel, or local regulations. By having a well-rehearsed emergency preparedness plan, laboratories can minimize the impact of unforeseen events, protect their personnel and facilities, and ensure the continuity of their operations.